Hello friends, welcome to our channel. Today we will discuss about the most prevailing topic of H3N2. H3N2 cases are rising all across the globe, especially in India, but the most promising issue right now we are facing is influenza and H3N2 related infection which are occurring in children. Generally, flu occurs in the change of season. Due to this drastic climate change and the seasonal changes, this H3N2 and influenza infections are very much rising, and children are suffering most because of compromised immunity as well as because of poor hygiene condition. Now, the normal flu lasts for 5 to 7 days, and flu is treated symptomatically. There is no antibiotic required to treat the flu-like condition. Because this H3N2, which is a subtype of influenza A virus, is lasting more than 15 to 20 days, people are worried and taking antibiotic. Indian Medical Association has also given a strict guideline to not use antibiotic for the management of flu-like symptom. General flu-like symptoms are sore throat, dry cough and fever. But nowadays patients or especially children are suffering from vomiting, diarrhea, dehydration, lethargy and severe weakness. This condition need to be treated and the expert opinion is required. To encounter with this issue, let us take some advice from a good pediatrician or neonatologist who is handling H3N2 cases in pediatric and has given a very good options to treat and how to manage this condition for parents as well as for physicians. So I would like to introduce one of our leading practitioner in Surat in pediatric department, Dr. Tushar Poshiya. He is a consultant in Anand Hospital, Tax Hospital and Poshiya Children Hospital. He is a specialist in intensive care unit, neonatologist as well as pediatrician and working since 5 to 7 years actively in a healthcare setup and also involved in research. So let us understand from him what is H3N2 virus, how it is invading the human body and how influenza like conditions will be prevented using different vaccines as well as symptomatic management.
Hello everyone, this is Dr. Tushar Poshiya, Pediatrician and Neonatologist in Surat. Today I will be talking about the flu-like illness which I have seen in children in last few months. This time this illness lasts around 14-15 days as compared to the previous year, where this illness lasts around 5 to 7 days only. Symptoms include moderate to high-grade fever, persistent cough lasting for almost 14-15 days, cold, difficulty in breathing, irritability, weakness, headache in older children. Two most common viruses I have seen in this type of children. One is the influenza H3N2 virus and second is the adenovirus. Treatment is mostly symptomatic and supportive care like a cough syrup for cough, antihistaminic, antipyretic for fever. Hydration play important role in this type of illness. If your child hydrated, at any point of time you feel your child become breathless, decrease activity, decrease oral intake, contact your pediatrician. How you can prevent this type of illness to your children? Proper hand hygiene, wash hands properly, avoid going into the crowding area, proper hydration, and vaccine for flu influenza virus is also available. So get your child vaccinated with the flu vaccine. Prevention is always better than cure. Thank you.
I hope now you all have understood how to save your children with the H3N2 as well as adenovirus from the Dr. Tushar Poshiya's advice. Now it is very important to understand that influenza vaccine need to be taken on the yearly basis. Actually, influenza is caused by influenza A and B virus. This virus has some genetical structure. The vaccine which is acting against influenza is binding to the core of protein which is created surrounded the genetic material, and this core of protein is keep on changing, and that is why every year new vaccine need to be generated in order to fight against this influenza vaccine. So it is a myth that once we take the vaccine it will give us lifelong immunity. In case of influenza, the vaccine need to be taken on the yearly basis, and it is advisable that before certain drastic seasonal changes, our children need to be given a flu shot so that children will be saved from the influenza like condition or H3N2 or adenovirus like condition. So I hope the vaccination related myth is very much clear to everyone, and now from now onwards we promote that influenza vaccine will be given on the yearly basis in order to prevent with this kind of flu or influenza like infections. Thank you so much.